We believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Dr. On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hello and good evening, ladies and gentlemen. I am Ezra, your host for today from Dr. On Call. And before we begin, I would just like to inform that do share and tag 3 friends as well as the live video going on now, and stand to win a chance to win a free teleconsult with Dr. Navdeep himself. And a little insight before we move in. I'm also a patient of Dr. Navdeep and pregnant 7 months right now. So to recommend Dr. Navdeep, for my personal experience, I would say that he is very experienced, he's very warm, and a very dedicated gynae. I also like to welcome Umi, Dania, Mawar, Sia, Alia, Cik Saya, Zayan, and Asma, as well as Sharifa. So, a warm welcome to this session where we'll be talking about pregnancy during this pandemic. So, a little about Dr. Navdeep's background before we begin for you viewers. He received his specialty training at University Malaya, where he obtained his master's degree. And in the United Kingdom, he was awarded the Royal College of Obstetricians and Gynaecologists MRCOG membership. He trained in laparoscopy surgery in India and obtained a membership in and diploma in minimal access surgery, as well as he got his completed his course and he attended it in Singapore for assisted reproductive techniques. To add on, he's also a member of the American Society of Reproductive Medicine, European Society of Human Reproduction and Embryology, International College of Surgeons, the Asia Pacific Initiative on Reproduction, and the World Association of Laparoscopic Surgeons. To sum it up, Dr. Navdeep has experience and specialty ranges from minimally invasive endoscopic procedures, including laparoscopic hysterectomy, and infertility management, including IVF. As you all can know, the list is pretty vast, so that you are in good hands. Dr. Navdeep is currently a medical director and practicing at Thomson Fertility Center in Puchong. And just before we begin, to quote what Dr. Navdeep said, reaching 100% of the success in fertility rates is an ambitious goal that may not be realistic, but it is a catalyst for me to try harder. So let's bring on Dr. Navdeep now. Over to you, Doctor.
Hi, thank you very much, Ezra, for those very long and kind words. Well, today, to all listeners, welcome to our talk today, and very good evening. So, we'll be talking about pregnancy during this pandemic. So, what's a pandemic? It's basically a disease which is prevalent over the whole world or all the countries. Okay, so COVID-19, as you know, was declared pandemic in March last year. And till date, more than 2 million have lost their lives. And the disease was confirmed in more than 100 million people. But what's positive here is that the recovery rate has been really good, where 61 million people have survived the disease. So there is definitely a light at the end of the tunnel. Back in Malaysia, back home here, we had these multiple movement control orders, and a lot of things were imposed upon us. They were inconvenient, yes, but it definitely did give a good effect to the country, and it did mitigate a lot of things. And in my opinion, it was necessary. And coming soon, on the 21st of March, should be our vaccine coming to Malaysia, be the Pfizer vaccine. So coming to fertility, well, lots of patients ask me this question, whether do I need to wait till the pandemic's over, or should I get the vaccine first, or what should I do? My take on this is that you don't need to delay or wait, because age is definitely a problem. The longer you wait, the tougher it gets for you to conceive. So before you do the procedure, generally we advise patients to do a nose swab test first, depending on whether it's an IVF, egg retrieval, or embryo transfer. Advise them to ensure that they're negative. But unfortunately, if they were positive with the disease, then what we'll do is we'll advise them to freeze their embryos for future use. And once you get pregnant, there are a few things that you need to know. So based on the risk factors, all adults, be it pregnant or not pregnant, our risk is generally the same. So since this COVID-19 is a relatively new virus, so the doctors and scientists are learning more and more as time goes on. And but the positive point is that there's no risk of increase in miscarriages or abnormalities to the baby. The other issue that all of us are afraid of is the mother-to-child transmission. there had been seen that some babies had COVID-19, but it was unsure whether or not it was due to it was before the delivery, during delivery, or after delivery. Okay, so but all the babies, rather most of the babies, were discharged well without any problems. And as for the amniotic fluid and breast milk, so far most of the evidence have not shown any positive viruses, diseases in the breast milk or amniotic fluid. So, like in all diseases, well, there are evidence that there may be a transfer to the baby. So what we need to do is that we need to be more careful and be reassured that most of the babies were discharged well. As I mentioned about development and all, there was no risk of intrauterine growth restriction to the baby or babies born with any problems. But there were babies born prematurely. Now, there were two reasons. One is mainly if the mother was very unwell and need to be intubated and you need to give them some more advanced care, then yes, the doctors will generally deliver the baby first. But some patients went into spontaneous labor earlier. So the most important things that we have been hearing over the whole 1.5 years now from our government guidance and all is basically take care and be careful. Wash your hands regularly, use a tissue paper if you have to sneeze or cough. Avoid contact in large crowds, especially if any person who has symptoms. Okay, and try your best to work from home. That's a new thing nowadays, which is good in a way. So you can avoid all non-essential public transport when possible. The other thing about festivals and all, yes, I know it's painful to miss festivals, especially you want to balik kampung, go and visit your family members. Yes, it is definitely. But for a time being, especially if you're pregnant or you plan to get pregnant, I would recommend that you avoid those large gatherings. Keep in touch with all this remote technology instead. Your phone, Facebook, or social media. Use the telephone more frequently and you can call up your friends and family. Now, for those patients who are already pregnant, it's important that you don't skip your appointments. You may want to space out the appointments to be, a bit more infrequent. Okay, but it's important to do it. The simple reason is this: that maternity care has been developed over the years, and it's known that to reduce risk for both you and your baby. So you should go and see a doctor, and you should go and get checked to ensure that your baby is growing well and your pregnancy is going on fine. There are a few risk factors, there are a few things which the doctor will look at, especially those patients who have gestational diabetes, or those who are obese, or those who have hypertension. Now, these are the three main points that were seen to have increase in risk in developing the COVID-19 as complications. So you'll ensure that you're not hypertensive, you control your sugar and your weight for you. So there are other risks also to the baby, which during or the mother during the antenatal care, which we will detect. Okay, so coming to breastfeeding if you have COVID-19. Well, general guidelines in Malaysia, we advise against breastfeeding. However, certain countries in the world, they still go ahead with it, but they'll advise you to take precaution. Example, make sure you wash your hands, cover your mouth and nose with a mask, and even better is to use a breast pump instead, and to pump it and let somebody else feed your baby. That'll be much better, safer for your baby. So, in short, there are a few things that you need to do to protect yourself when you're pregnant. It's like wash your hands more regularly. If you don't have soap, don't worry. Just use your hand sanitizer, at least 60% alcohol. That's very safe. Avoid touching your eyes and nose, because these are entry points for the virus, especially when you touch an area and you touch your nose and mouth, then you will you're bringing the disease into your body. And if you know of anyone who is sick, especially in your workplace or at home, then try to avoid them, try to advise them to go and seek medical attention as soon as possible. So if you can, the new word that we use nowadays is social distancing. Well, that itself has helped many people avoid the disease. Okay, so keep a distance from others, especially those who have a higher risk of getting disease. Now, if you have the symptoms, for example, fever, cough, shortness of breath, sore throats, it's important that you seek medical advice immediately. It may be just a normal common cold or normal cough, cold, fever, but you never know. If it's COVID-19, earlier treatment, the better outcome. So the incubation period is when you get exposed to a time when you get the symptoms, maybe between 2 to 14 days. In average, it was 7 days. Now, emergency symptoms like trouble breathing, chest pain, or pressure in your chest, these are things which you need to call your clinic as soon as possible. Now, about the vaccine, as I mentioned, Malaysia will be getting their vaccine on 21st of March. Okay, the vaccine has not been tested in pregnant women, but the UK they are planning a study which want to use the vaccine on pregnant women, and I am sure it's going to be safe for everyone. So just to give you a little history on vaccinations and pregnancy, the first vaccine was given to women was in 1879. It was a smallpox vaccine, you know. So and what happened after that? The number of smallpox cases started to drop, and it was perfectly safe for the mothers. And the other things that a lot of patients get nowadays is anti-tetanus toxoid. That too will prevent you from getting a disease. So the other example would be your influenza flu vaccine, okay, which is perfectly safe for everyone. So likewise, I'm sure the COVID-19 vaccines will not cause any harm, and definitely you should get it, especially if you're planning to get pregnant and you're pregnant and you're in the front lines. Then it's highly recommended you get protected with it. There are a lot of groups, criticizing the vaccines and all, but I think if you look at statistics, it's really clear that the vaccines are going to protect you from hospital admissions, ICU admissions, and worse still, death. So better get protected. Any questions about the COVID-19 and pregnancy?
Yes, please do post your questions as Dr. Navdeep has given us his time here today. Okay, so we don't have any questions yet, but just on general note, doctor, do you have any patients that you meet on a daily basis who has these concerns of especially vaccination or going out into public places and whatnot?
Yes, I do. A lot of patients have spoken to me about it, and I make it a point to talk to some of my patients about it. Reason being is that I think knowledge about a certain thing which will definitely protect you. So yes, so I do recommend everyone, family members of theirs, to go and get the vaccine.
Okay. And would you encourage work at home as well as much as possible? Because for those mothers, I think that will be like a very big concern for them to go out into an office place or an open environment.
Oh yes, definitely. For patients who are like currently pregnant, okay, or in a high risk group, then yes, they should, as far as possible, work from home. Okay, but then again, there's certain jobs where you can't work from home, especially doctors, police, military, and they have to be at their post or their workplace. So for those people, well, I'll advise them to rotate. So not just ensure that everybody, the whole team, does not be in the same place at the same time. Probably can rotate the group, divide to certain groups like team A, team B, team C, and rotate the groups around. That will be something which you can do to reduce the risk of your entire team or entire workforce getting the disease.
Right. Thank you so much. We have a question here from Mr. Aaron. If the mother has positive COVID and gets pregnant, will the child be automatically immune to it? I mean, if the mother survives and recovers.
Well, immunity after a disease is basically unknown yet. Okay, because we had there are still reports of patients who had the disease recovered and eventually got the disease again. So whatever it is that it's basically unknown. It's only time will tell. But in patients who have got the disease and eventually recovered, they too should get the vaccine as far as possible.
Okay. And in your experience, doctors, do you feel that the vaccine would be totally safe, or I mean, since we have not actually got it here yet, so for mothers to go ahead or wait for the first few batches to go ahead and see if it really no side effects and things like that, because that definitely be in the top of the minds of pregnant mothers or people.
Yes, correct. Yes, I think.
And
Generally we have to wait for your turn because there are a lot of people out there who are, like I mentioned, the frontliners will have to get the medicine first. So and then subsequently come in the high risk group. So usually when it comes to people who are pregnant and children, that everybody is a bit more cautious, right? But I'm sure eventually, when your time comes to get the vaccine, go ahead. It will be safe. The risk that you're talking about when you take the vaccine, okay, you may get some headaches, some fevers, the injection site will be a bit painful, get body aches. So that's actually quite common with lots of vaccine. That's basically the reaction your immune system, your body towards a vaccine. Okay, and but the risk like allergic reaction like an anaphylactic shock, that's it's around 0.1 over 100,000 people. So the risk is rather low. Nevertheless, if you were to take the injection, all right, you'll be observed for some time before they allow you home to look for any risk of allergic reactions. Then about after half an hour to an hour, if everything is fine, then you should be all right.
okay, thank you, doctor. We have a couple more questions. Is that okay, doctor?
Go ahead, please.
What are the important supplements needed for a mother to have a healthy baby due to this COVID? Is there anything extra, or what would your advice be? Should they take as a daily consumption?
Okay, so there are two parts of this. There's one, the pregnancy supplements. Well, things you need to take is like folic acid, iron, okay, calcium. These are important, okay? And because the folic acid will reduce the risk of your baby to get brain, scalp, spine problem by more than 70%. Okay, and iron ensure that your red blood cells are fine. Now, coming to COVID in particular, okay, certain studies have shown mainly three types of supplements that may help in your immune system and reducing the risk of getting COVID. For example, your vitamin C, vitamin D, at least more than 1,000 international units per day, okay, and zinc, okay. But this was mentioned some time ago by certain scientists or certain experts in the US about these three things. But some studies have shown positive effects. Some studies have shown not much of a benefit, but negative effects, none so far. So you can get some vitamin D, vitamin C, and even your zinc supplements from your local pharmacy, and I think that'd be good enough. But still, no matter what, vitamins only can give you a certain amount of protection. So you still have to put on your mask, wash your hands, and practice social distancing. That will help you more.
Okay, great. Thank you so much. Very insightful, doctor. And also, we have a question. While having COVID-19, are there any effects from delivery or postpartum care?
Yes, generally some patients, if you were to have COVID-19, okay, most centers will do a cesarean section for you, okay, and the baby will be observed in the ICU in the special care nursery, and until the time when you are safe and fine and you're asymptomatic, and then you can be with your baby and be discharged. So the care, antenatal care, will be mainly in the referral hospitals, for example, in Malaysia, Sungai Buloh and HKL, okay, and postnatally, you'll be followed up by the team over there. And but as for patients who do not have COVID, then generally the antenatal and postnatal care will be similar like what we're doing now. But some centers have stopped, have not, they do not allow the husbands to come into the labor ward or the OT. As for the centers which allow, like ours, what we do is we advise the husbands to do their nasal swab test to ensure that they are negative too. So in that way, we ensure that the mother, the baby, and the staff are also protected. If we try to avoid getting a COVID a partner into the labor ward or the OT.
Yes, definitely prevention is better than cure. And the next question, Doctor, on the side note, during this pandemic, what are some of the coping mechanisms that you would advise pregnant mothers or even couples, as in husband and wives, to deal with stress while pregnant? Like loss of jobs, financial restraints, and or even working from home together. Sometimes would cause stress. What would be your advice for them?
Well, generally, most importantly, you must understand, you're in this together. Everybody is in this too. Okay, husband and wife, well, should try to work out their differences or try to, to be avoid stressful situations. Example, a loss of job. Yes, of course, there will be certain financial implications. Okay, so avoid unnecessary spending. Okay, the other things would be, stress sitting down at home and cooped up in a certain area. Well, you can do things like mindfulness, yoga, even do exercises together. That will definitely help you to relieve the certain amount of stress. Walking around your housing area or your apartment if you stay in one. Okay, those things will help too. Do things together. And basically communicate. So I think the most important thing is that to avoid the conflict. I think communication is the best way.
Okay. I hope you guys are taking all this wonderful and insightful, knowledgeable advice from Dr. Navdeep. Please do be reminded to tag your 3 friends and share this video to stand to win a free consultation with Dr. Navdeep. And so for the next question, from Miss Raisha is, apabila kita mendapat COVID, apakah langkah-langkah untuk mencegah COVID daripada janin kita towards the child, I guess. That's what she's asking, Doctor.
Okay, basically it's called the vertical transmission. Okay, so vertical transmission, yes, is probable, but have not been seen yet. So to avoid basically is number one, you can do a cesarean section if you are in early stage of labor. Okay, and then you have to be separated from your baby until a time when you have recovered from the COVID-19. Okay, and these are the only few things, because once you have COVID-19 and the baby is in you, then and all basically depends on how bad the disease is for you. So most importantly, you have the symptoms, go and see a doctor straight away and get tested, because early treatment is definitely much better. So avoiding your fetus from getting it, it's honestly, I think nobody knows what to do, but we know for sure that the risk for your baby is definitely very low.
Okay, thank you so much, Doctor. I think which leads us to the next question from Miss Raisha is, bila mak kena COVID, adakah bayi dalam perut automatically ada COVID atau tidak?
Tak ada. Dia takkan dapat COVID dalam rahim. No, they won't get, because as I mentioned, it was vertical transmission. No, they will not get it because there was no cases detected so far. And even if the baby gets it, okay, reassuringly, most of the babies were discharged well. So don't worry so much about the baby. Baby will be fine. Unless, of course, it was a premature delivery. Yes, then it will be, and it depends on how early the baby was delivered. And if it's too early, less than like 28 weeks and all, yeah, that will be a bit problem. But more than that, if you're good NICU care, shouldn't have a problem.
Okay, and just to recap a bit, Dr. Navdeep, we mentioned about those who are working in the front line, who are actually pregnant during this season, which has been ongoing for some time now. Is there any other kind of special precautions that they should be taking apart from using the mask and social distancing and using sanitizer? Or would that be the best approaches?
Well, that be
or met-
generally what they do is they'll be wearing the PPE. They'll be wearing the face shield and all the gloves, okay, and your a gown, which is a waterproof gown. Those are the things that will be important. And also the other thing important will be how you put it on and remove those protective gear, uh, and uh, and make sure that you practice when you go home and all. Just throw the clothes for washing straight away and have a bath and all, before you mix your family members. That's about it. All those things, especially the things which we have already been told time and time again. Just be more careful. That's all.
Okay, thank you. And Dr. Deswat, there are a few more similar questions to that. Is that when a woman is pregnant, is there any time because we have trimesters that we have, is there a specific time that they should take the vaccine, or is it any one of those trimesters it is best to take it?
Well, I wish all doctors knew the answer. I mentioned to you just now, so far the COVID-19 has not been given to pregnant women yet. Okay, but from our past experiences with the vaccine, with other vaccines, usually pregnancies during the time, any trimester should be safe. But generally, most of us prefer to give the vaccines after the second trimester.
Okay, great.
Second and third trimester would be good.
Second trimester. Okay, thank you so much, Doctor. Looks like we don't have any other further questions. So we would like to extend a big thank you to you, Doctor, for your time, as we know that you've been having a busy day and you have other sessions coming. So we look forward to having you with us again in the next session. So if anybody do want to have a teleconsult or know more about Dr. Navdeep, please come onto our website under doctoroncall.com.my, and you can have a look at Dr. Navdeep's profile and also book a teleconsult with him. Thank you so much, everyone, for joining us in this session.
All right. Thank you. Bye-bye.
Have a good day.